I have a lot of fond memories being here. Probably the most, though, was the first fundraising campaign we did. That may sound rather odd, but we did our first fundraising campaign in 1993, which was right after I became CEO. And at that time, we really weren't quite sure what the community thought of Virginia Gay Hospital. So this was kind of a test to see where the support was, and if they actually would support a fundraising campaign to kind of prop us up and get us back on our feet again. And the support was overwhelming. The response to the campaign was absolutely overwhelming. We exceeded our goals. We were able to put a lot of equipment in place that we really needed, put a big expansion on our nursing home, and I think that kind of propelled us to where we are today. We have a much closer relationship with our community now, I think because of that initial fundraising campaign. We take ownership of the community's health. And I think that's really what sets us apart from probably the larger hospitals. We know a lot of people that we care for, and along with providing medical services for them, we do a lot of the outreach services. The Reach Out and Read program, for example, which was just introduced last week, is an effort to try to get young kids reading books, or at least parents reading books to their children. We do a lot of community events, participate in a lot of community education programs, trying to get people engaged in making themselves well. So that's our focus. We take ownership in what we do here in the community. The future is great for Virginia Gay, and that's because of the strong support we have in our community. Everything that's going to happen going forward, whether it's the current system we have in healthcare, or if it actually does evolve into healthcare reform with accountable care organizations and everything that's being promised through healthcare reform, we're very well positioned for it. Thanks to the support of the community, we've completely updated and remodeled every area of the hospital. We have modern equipment. We have great staff, experienced staff on hand. So no matter where healthcare reform goes, we're going to follow along and we're going to be just fine. I've witnessed so many wonderful things here. The neat thing about my staff is that I don't really have to tell people to do much of anything anymore. They know instinctively what has to be done. Whether it's caring for a patient or in an administrative role, my staff is pretty self-actualizing. And so I think that's what I'm probably proudest of, I think, is that we have a staff that knows what needs to be done, and they continually go out and do it. And I think that bodes well for when I leave here, that there's a good, experienced staff that doesn't require a lot of hand-holding in order to do what has to be done.